Chikitsastana, that is 15th chapter, dividing the Chikitsastana into two parts. That is what importance of the Samhita, Grahani Dosha has been placed in between. So that is a very important chapter, the Hridaya in the Samhita. So once if any person understands the Grahani Dosha Chikitsa, he can be a gastroenterologist in Ayurveda, I could say, in one word. So to begin with this session, Grahani Dosha Chikitsa. So why the name is Grahani Dosha? Why not it is the Grahani Roga? Because in other chapters, names it starts as Pandu Roga Chikitsa, Vatarvadi Chikitsa. Why it is not Grahani Vyadhi or Grahani Roga Chikitsa? Why the name, the very name starts with Grahani Dosha Chikitsa? Let's hear from S Prashanth sir, like how the nomenclature of this disease has been started. Over to you, sir.
Most respected Dharmaji sir and the team of tadvidyasambhasha, my dear students and delegates and teachers across India. A very 15th chapter in the Chikitsasana of Charaka is Grahani Dosha Chikitsitam. There are 30 chapters, you know very well why the exact middle point, the center is Grahani. Because Charakastu Chikitsa kariye. Kaya antaragni Chikitsa, Kaya Chikitsa. Kayasya Chikitsa, antaragni Vyapara. The metabolic events, the digestive events, Ama and Samadosha, conclusively from the physiology, that is Kriyatmaka Varnana, Grahani, when the name comes, physiological consideration of the Grahani, physiological aspects, how Grahani does the various Vyaparas, Annam Granati, Pachati, Vivekati, Munchati in association with Samanavayu. What is Samanavayu? Samano Agni Samipastaha, Sveda Dosha Amuvahini Sotamsi Samadhichitaha, Samano Agni Balapradaha. So when Samanavayu, probably the vasovagal reflection of the celiac trunk, when it is stimulated, how the Pachakpitta, Ledakafa, and Samanavayu in the form of Anna Sangata, Kledana and other activities that it involved. So, Grahani for the Kriyatmaka aspect. When we go to the applied aspect, when these disturbances are taken place, probably a condition which is not told by Acharya Charaka elaborately, what is called Amrita. And a parallel textbook, Samakhalina Grantha like Kashyapa, Vrta Jivakiya Tantra, how come Amrita Prakana has been seen? Why Nibandha Sangarakara explains certain aspects? Though in the Sutrasana, Acharya Charaka in the 25th chapter in Yajna Purushiya said that Kulataha Aprapatya Janatana Adbiramba Vipakadi Vivocha Ipichit Adisham Tullet Kale Deshe Skandhatvam Aprapatya as Prabhupada says Samsujyamanam Nidivrittena Dahatrishna Mukhamena. So the physiological aspect to the applied aspect. Now the Kriyatmaka Grahani. When an anatomy subject is going on, a teacher of anthropology or anatomy is described Grahani Namaka Nanika. It is a tubular organ lying in between Amashaya and the next part of Tantra. So that this tubular organ, starting from the amber of the vader, open of the stomach to the duodenum. So duodenal aspect must be Grahani. That should be the Annam Granati, Vivekati, Munchati in association with the Samanavayu. It is going to help. Pathological events, Nidanatmaka Drishti. So we have to have a broad sense that a patient with Grahani Roga comes. In certain occasions, it's called Grahani Roga, but Acharya Charaka has spawned. It is Grahani Dosha because the very Grahani is getting afflicted, its vyapara is getting targeted. Therefore, whenever you address a student must be very regular, but some of the students are regularly irregular. Some of them are irregular. Now, regularly irregular is possible due to the jalatva of vayu. Jalatva of the vayu. Vishamovarni kadachit pachyate, kadachit navipachyate, kadachit admana shura udavarta krutva pachati. So, Vishamadri vyapara, when the Agni vyapara is good, Vishamovarni kadachit pachyate, then the patient is getting more baddhata. Kadachit navipachyate, and sometimes the ahara and pachana vyapara is in association with some symptoms. So, he may get Drava Mala Pravartana, more Baddham, more Dravam Va. In association with some symptoms like Atmana, Atopa, like different aspects. When all collectively it is said, it becomes Roga Sankara. Therefore, Atmana, Atopa, all other symptoms are seen in a Grahani Rogi. What is Atmana? Kuksha Atmana Paite Atyattam Pratamyati Paripujati Niruddho Marutastheva Kuksha Uparidhavati. So patient comes, if you read the Adam's physical diagnosis, so very beautifully he said that tympanic abdomen, nowadays that sound is missing, that word is missing. If you even surrender yourself to Google Master says no, because Google is our teacher. So we will browse for some word, it will download and explain. Tympanic abdomen, Atma Pati Atyattam Pratamyati Paripujati, will getting some sound, abdominal sound inside the abdominal cavity. Niruddho Marutastheva, this power of the Maruta is getting moving inside the costa, producing some symptomatology. Atmana, Atopa is different vyapara. So Vishma, Vanni, Kadachit Pachyate, Kadachit Pachyate, Kadachit Atmana Sura, Udavarta Krutva. So this aspect of, in total, the physiological aspect, Kriyatmaka, Rachanatmaka and Nidanatmaka aspects should be totally considered. When the Grahani vyapara is targeted, it becomes Grahani Dosha.
Thank you very much, sir. Om Shri Dhanvantari Namaha. The chapter of Grahani, it is so pivotal that the name is given as Grahani Dosha Chikitsitam, but actually we are doing Chikitsa for Agni. This is one of the Tantra Yukti Pramana to understand the title. Sometimes Guhya Bhasha is used by the Granthakara, that by giving such a versatile title for the chapter, he wanted to tell Chikitsa for Agni Vikara. But he has given the name as Grahani Roga Chikitsitam, Grahani Dosha Chikitsitam. Here, the context is the entire chapter runs behind the management of impaired Agni. And Kayasya Antaragni Chikitsa, as Professor Prashanth sir said, if a Vaidya understands the Chikitsa of impaired Agni, he is real Ayurveda Vaidya. If a modern doctor understands the management of tuberculosis, he is the best modern physician. That concept we have to apply here. The entire chapter runs behind, in and around the management of Agni. If Agni is Sama, it is Arogya. If Agni is not Sama, in any three superlative or other degrees, the whole chapter concentrates on Ashraya Ashraya Chikitsa. Grahani is Kala. Grahani is an avayava. Shashti Pittadara Nama Yakala Parikirtita. Pakwa Amashaya Madhyastha Grahani Sa Prakirtita. The entire structure, the anatomical structure, the physiological activities, and what pathology takes place due to the Ashta Avayavas. Udundakam Pupusascha Koshta Ityabhidiyate. There are 8 organs related to this Annavasvatas. Panchadasha Koshtavagani related to Annavasvatas. Ayurveda doesn't talk about organ related diseases directly. We are not going to the level of microscopic, structural, organic diseases. We are talking about 3 dosha chikitsa. We are talking about three doshas and their relationship with Agni Chikitsa. One who learns Agni management, he will become a best Kaya Chikitsa. That's why this question has been asked, and we should know that at the end of the session, the student should be able to understand what is Grahani Dosha Adhyaya and what is intention or Dukhya concept of the author is to understand impaired Agni, correct the impaired Agni. Whether it is thyroid dysfunction in the name of Agni Vyapara, hypothyroidism is Agni in a declined stages. Hyperthyroidism is Agni is in Vata Pitta increased stage. And even Bahu Agni, Atitikshna Agni is Bhasmakaruga also, that will be the ending of the chapter. So in this chapter we are able to notice not the organ or tissue related disease. It is tissue giving ashraya for Agni and Agni related Vyapara, Agni related Vikruti and that Agni management. And there is no hurry in treating this Agni. This is not a 20-20 match. This is not a fast food match where you quick prepare and eat and go. Agni has to be maintained in such a way that once it is Vikruta, treat it properly and for a sustainable period of time, see that this Agni is completely becoming to the normal. This responsibility is there with Vaidya. Loading the medicine is not treating the Agni Vikara. Actually, in the name of Agni Vikara, people will prescribe multiple drugs. That is called drug loading. Drug loading is not a correct concept as per Grahani Dosha because that Agni is unable to digest even the churma, even the manda, peya, vilepi. Not even it is unable to digest the water also. We consume water that may not be digested. In such condition, we should be able to gradually ignite the Agni, bring it into the Samya Avastha by means of first Patya Kalpana, then Shodhana, then Pachana and then Brahmana. That's why in future I hope Dr. Prashanth sir will give more emphasis on many Sneha Kalpas are told in Grahani Adhyaya. It may be Chandya Adhyaya or it may be Trivishana Adhyaya, Panchal Adhyaya. These Bhuta Kalpas are Brahmana Kalpas. They are Brahmana for Agni only. And this is an indirect course. This is an indirect carrom game. You hit the Agni and correct the doshas and Agni sequence so that Grahani Dosha becomes normal. This is an indirect management of impaired Agni and also impaired doshas. That's why Grahani Asritam Dosham, Grahani Dosham iti kartete. You are not treating Grahani tissue or you are not treating Grahani structure. You are treating the functional aspects of Ashrita Dosha and Ashrita Agni. I think your question is coming to me.
Thank you both the sirs for in detail explanation about the entering into the Agni, the introduction part of the Agni and Grahani Dosha Chikitsa. So we will now enter into the main part like the Vidhana Panchakas and all. So nowadays we see so many positive factors for the Agni Dushti. Like so many people are having excessive amount of water that like Atyamupana, like in the morning so much of water they will be drinking. And we see bigger bottles having labels like 10 a.m. this much should be drinking and all. So that is Atyamupana, Vishamashana, everything. So Acharya Charaka has mentioned that in Chikitsitam 15, shloka number 41, Yohi Bhukte Vidin Tektva Grahani Doshajan Gadan Sir Voga Dabate Shigram Vakshante Adha Paramtute. So by the lowliya of eating so much. So next in the continuation he says Abhojana, Ajirnati Bhojana, Vishamashana, Rasatme Guru Shita, Atirusha Sandushta Bhojana, Deka Vamana, Sneha Viprama, Vadi Kashana, Desha Kala Rutu Vaishamya, Veganam Charidarana, Dushyati Agnihi. Sir Dushto, Natan Pachati Lagvapi, Apachamam Shuttatvam Yatyana Visharupana. So this Visharupi or the Ama Swarupi, Visha Swarupa Ama which is there, which is in future going to cause all the Agni disturbances. So I request sir to put some light on this concept of how the hetus should be understood, and also I request sir to put some light on today's hetus. These are the hetus explained by acharyas. So what are the causes, what are the ahara and viharas which are causing the nowadays today's Grahani doshas and some contemporary diseases told in modern science?
It is experienced by everybody that Udgara Shuddhi Utsaha Vegosargo Yatochita Laguta Tuj Pipasa Jirnaha Sarakshana. Ahara which is consumed need to be getting digested by the Agni Vyapara timely. The symptoms like Udgara Shuddhi, because when a patient is undergoing Snehapana, Snehodgara is one of the phenomena. Some cases are reported with Amladandi Udgara. Some of the other cases, they will come with Matsyagandhi Udgara, because Matsyagandhi Udgara is a condition probably noticed in abscess of the intestines. Shuktodgara, in which the fermentative order is getting produced. So Amladandi Udgara, Tiktodgara, Shuktodgara, like various Vyapadani or the abnormal situations are noticed. So therefore, Udgara Shuddhi is an important aspect when the Ahara Jirna is attained. Utsaha, one should be very active. He should not be lethargic. He should not be suffering from any fatigue. Therefore, usually I address my students that exact opposite finding of Utsaha is Alasya. What is Alasya? Sukha Swapna Prasangitvam. A person, though he is Shaktiman, though he is looking very much solid, very much Dhrida, Sukha Swapna Prasangitvam, and he will be enjoying always sleep. Dukkha Dvesha Anuruta, and any effortful exercise, any painful activities, he will believe it is not possible from me. So if his grandmother said that you go to some area, go to the railway station, bring your relatives. Today one of the relatives is coming from, a friend is coming from. So early morning, 5 o'clock you have to go there. My dear grandma, see, by 4 o'clock I cannot get up. 5 o'clock I have to reach the railway station. It is beyond my reach. So he will try to explain. And if you are that interested, why can't you go to the railway station and bring the friend? So Sukha Swapna Prasangitvam, Dukkha Dveshana Bhurta, Shaktasya Kapi Anusaha. Though he is looking very smart, very beautiful and very young and energetic, Shaktasya Kapi Anusaha. I also indirectly, when my active classes were going on, I had to tell my students that when a patient of Kamajvara, because we are the Grahani I am telling, when a patient of Kamajvara comes, Kamade Chitta Vipramcham, Tandravarasya Mavojanam, Hridaye Vyakurata Chaiva, Gatram Cha Parishishyati. So the patient approaches. I had a case. An young boy studying in a college, he met with some love affair. Good. It's not a very uncommon phenomenon, the common scenario. So he met with a love for with a girl. Now initially it was going well. So just like our BMS course, what happened in first year, more than 3 subjects were failed. So once the 3 subjects are failed, means he is unable to go to the next session. So girl started getting promoted gradually, and she started neglecting for his information. He thought that she is neglecting because he is getting passing through. So Kamaja Chitta Vipramsam, he thought that now she is looking somebody and behind. Kamaja Chitta Vipramsam, there is a lot of psychological imbalance. Hridaye Vyakurata and Hridaye Vyakurata, palpitations. Abhojanam, so lack of interest in taking food. So in Grahani Adhikara also, Abhojana, Atibhojana, Atyasana, Anasana, Ishamarachanadi, various Vyapadana, various findings. So they are getting involved in all these activities. Tandravasam Abhojanam, Hridaye Vyakurata Chaiva, Gatram Cha Parishad. Now this grandmother was sitting in the house. My dear young boy, my grandson. So you are very active, playing with the mobiles, always 24/7, were on the smartphone. But nowadays you are looking so dull. Very beautiful breakfast I have prepared. So beautiful lunch is served for you. Why not taking food? Aji, out than the Kaikot. So, Amaja Chitta Vipramcham, Tandralasya Mabhojanam. Tandra and Alasya are other phenomena. Therefore, Alasya, so Udgar Shuddhi Saha, Veko Sarpo Yatochitaha, timely excretion, timely elimination of the malas, especially the Purisha and Mutsatyaga. Veko Sarpo Yatochitaha, Laguta Chukpipasacha, Lagutva. Whenever the Amadosha is produced in the form of Amajirana, there is lots of Gurutva. Hence, Lagutva is the other phenomenon. It is very clear said in the Jararoga Prakarana. In Nirama Jara, Lagutamchit Pipasata, patient will be Tritramata Lagutvancha. So, Tritramatva, Lagutva. So, he is getting the appetite properly. He is getting the Shuddha Pravati properly. Therefore, Vegavara finding is also very important area. So, a Grahani Rogi, before he is getting the Lakshanas, he may be involved in a series of etiological factors like Anashana, Adhyasana, Vishamasana, this irregular food. In today's scenario, probably a person who is working for a company, an area manager, so he will travel from Belgaum to Goa, from Goa to Bangalore, again Bangalore to Pune, continuously traveling. So what about the food? Wherever my vehicle stops, in the dhaba I have food. Every stage food is getting exposed. Or katu, vidahi, barjitahanna. And because of that, as Kashyapa said in the Prakarana of Amnapitta, because I am stressing on Amnapitta is an area where Grahani Roga and Sutta Roga is told. Because of the now the Sankshepa Vistara Maya of the Shastra, author might have not told it in detail. Avishishtam yatam kshire, prakshiptam dadivadane, kshiprameva amratayati, kuchi bhavam chagachati. There is a vessel containing thadi, atakra, huli majjige, huli masaro, amradadi, amratakra, it was contained. If it is not cleaned properly, if the kshira is poured over that, and how the kshira, though it is madura, though it is pitta, though it is shita and guru, just like adya ahara sadhatu. Now the transformation what need to be taken, pachatyaknir yatastalyam odanayam stantanuram. If the rice is cooked well, how the anna is produced similarly because of the vyapara inside the koshta, Samanavayu, Pachakagri and Kledakapa along with Ahara Parinamakara Bhava, Amar Sampati is produced, Avishishkam Yatakshire, Prachiptam Dadibadane, Kshiprameva Amratayati, Kurchi Bhavam Jagachati. Kurchi Bhavatva, fermentation and fermentative dyspepsia. Acid reflux, what we call GERD. A patient used to tell me, sir, my diagnosis is GERD. Yes, I was looking what is GERD. So then I thought probably GERD, she is telling GERD. So GERD, gastroesophageal reflux disorder. So in which Dravaguna Buddhi of the Pitta, along with Uttatishta Guna, it's also getting increased. If the sun is getting beyond its limit is increased, then the patient is getting Atisana. Therefore, Urdhva Bhaga, Urdhva Gati, Adho so along with that, in the Grahani Avayava, so all these different stages, Avishishtam, Yatakshire, Prakshiptam, Dadivadane, Kshiprameva Amratayati, Kurchi Bhavam Chagachati, Rasarato, Yata Gande, Kshipram Vidakate. So all these different changes because of the Gunadishti, because of the involvement of Pachakapitta, due to Samanavata Vaiparitya and Kledakafa. I always think about Dhatu Tattva Prakarana. Vata Vyadi should be the ideal example. Probably Madhav also will add to that. Vata Shonita is another condition where Vata Dosha penetrates deeper into the tissues. Rasagata Vata, Rattagata Vata, there is Tvagata Vata, Mamsagata Vata, Medogata Vata, Astimajagata Vata and so on. Similarly, Uttana Vata Ratta, Gambhira Vata Ratta. So Vata Dosha goes beyond its limit to the deeper components. Jwara is an ideal example where Pitta Dosha takes its role, that is Rasagata Jwara, Raktagata Jwara, probably today's dengue, Asti Majjagata Jwara and so on. Similarly, Kushta is an ideal example where Kapha dosha takes the role and goes beyond its limit. That is Tvagata Kushta, Raktagata Kushta, Amsa Nedogata Kushta and so on. Now when Ammapitta comes, in the superficial layers of the stomach, that is gastric mucosa, digestive mucosa, peritoneal layer, submucosa. So these layers are getting involved one by one. So these nidanas contribute in making changes physiologically, pathologically, by into the erosions, etc. Therefore, Tektatvalatvam Pakadi Karmana Ananachapatam. When the Pitta, when the Dravata is not taking its role, and it is called as Agni. So, boiling water, it will, how it is going to cook the food. Similarly, the Pachapitta has got its own role. So, in Grahani Roga, stale food, street food, and uncooked food, and the different Viruddhahara, whatever is said in the Prakarana, should be the cause for the manifestation. As well, our author has not highlighted how Manasika Bhavas are getting involved. So, Arsho Atisara Grahani Vidascha Bhuyena Chapi Anyonya Nidana Dustra. So, Arsha Roga, Atisara Roga, and Grahani Roga, Anyonya Nidana Samyata. One by one, in each other, there is intermingling of the Hetus. So, one Hetu causing Darsha, the same Hetu may be resulting into Grahani Roga. One of the other Hetus, which is resulting to Atisara, may cause Grahani. Therefore, Vaya Shoka Atisara also need to be addressed in the context of Grahani.
So, till now, sir has explained in detail about the hetu of how the Grahani, today's hetus are causing Grahani. First, Dushyati Agnim Sadushto Nadat Pachatilakopi Apachamanam Shuktatvam Yatyanam Vishrupatam has been in detail dealt by sir. So that Visharupi Ama, when it goes into the each and every dhatu, how it penetrates into the dhatus also has been explained by sir. So that doshas samsrujamana pittena, samsrujamana kafena, samsrujamana vatena, how that the ama dosha combines with vata, how ama dosha combines with pitta and kapha, that has that concepts, and also the how the symptoms of the patient, how a patient enters into the OPD and exhibits his symptoms. By which symptoms, by knowing what symptoms, we should consider the patient as a Grahani Dosha patient. In this concept, I want Madhav sir to please in detail deal with this.
With respect to Dr. Dharmadhikari sir, how lakshanas will manifest in a Grahani patient? Whatever may be the clinical course, we call it with modern parlance or Ayurvedic parlance, we should be able to identify Bhumapya Agneya Vayavyaha Panchoshmanaha Sanabhasaha Pancha Ahara Gunan Swan Parthivadin Pachantihi. If this activity is impaired, Lakshana will start manifesting. How it will manifest is Tasyalingam Ajirnasya Vishtambam Sadanam Tataha. In that context, Janayati Amla Pittamcha Pittajamcha Aparanidam was explained. Coming to the manifestation, there are special contribution of Acharya Charaka school. The same Grahani dosha, due to the Vatasya Unmargagami Bhava, if it goes upwards, it is called Urdhvaja Grahani. The same doshas, when they have taken down to the Adho-bhaga, it is called Adhoja Grahani. Whereas this practice is not there in the market. Urdhva Grahani and Adho Grahani we are not doing. We are doing Kafanubandhi Amla Pitta and Vatanubandhi Amla Pitta, Kapha Pittanubandhi Amla Pitta and Vata Pittanubandhi Amla Pitta. When Amla Pitta, the Lakshana has been beautifully quoted, Shirasaha Rucha. When patient is having Amla Pitta Lakshana with Shiroruja, we call it as migraine headache. Actually, the person will be treated better with this Grahani Chikitsa. Then no need to give analgesics or antipyretics. With management of Grahani dosha only, the patient who is having Vata Pitta Grahani Lakshana, even in Chakradatta, Vata Pitta Grahani Lakshana has also been explained. Actually, Grahani gets involvement of Vata dosha, Vata Grahani, Pitta Grahani, Kapha Grahani is there. I want to bring to the kind attention of the audience that can we see all these cases in practice? For that, can you put my slide on that? I can put you some case studies. In case studies, you can see that with respect to our great teacher, Professor C.P. Shukla sir, he used to tell me, Sa Vata Gurma Hudroga Priha Shankicha Manava. Is it possible to see that means when I was in second year MD, he showed 2 cases of Vata Grahani. And treatment is with Madhav Diggavi Chikitsitam only treated, and patients were identified with Madhav Diggavi. And here we come across with the modern clinical case taking. In the modern clinical case taking, what happens is IBS, IBS-D, IBS-C, irritable bowel syndrome. These are all going to be the commonest correlations for us. Or IBD, inflammatory bowel disorders, malabsorption syndrome, SPRU, or even protein metabolism impairment causing the diarrhea. All these, even as sir was rightly told, we have Bhayaja Atisara and Bhayaja Shokaja Atisara, but when it came to the Grahani, we don't have Bhayaja and Shokaja Grahani. But gut anxiety is one of the concepts where a patient is having stress in the mind, will have gut anxiety. So microbiota of the intestine is disturbed, he will get Grahani Lakshana. So seeing one case study, what we can notice this case is a male patient of middle age. He came to the presentation that you can see this is a recently taken case. He is an engineer having a typical presentation. I asked, what is your problem? He said, sir, do you have treatment for Crohn's disease? I said, how can I say that you are having Crohn's disease? No sir, I know I am having Crohn's disease. He is very thin built engineer. One daughter is there, newly married for 2 or 3 years. And I asked, what are the reports? He said, all my reports are normal. See, these are the educated patient giving history. And he continued, sir, I took 70 ultrasonographs. You can see on the slide. 70 times ultrasound scanning is done, all reports are normal. He has not got any report. But his mobile phone showed all these things. He took 3 times CT scanning. See the history, 3 times abdominal CT scanning. That much of mind is upset. He is having shoka, bhaya, vishada and all. And 2 times upper GI endoscopy, 1 time colonoscopy, all reports are normal. And no ulcerations, no any other things. But see, one of my clinical observation, one in any case of anartava or atyartava or strivandetvam or menstrual irregularities, I observe one thing commonly that I have written in the right column, Swapne Sarpadarshana. This is commonly noticed, one of the hetu I found, that Swapne Sarpadarshana. These Grahani patient, I asked him, do you get the dream of a snake? He said, yes sir. I am getting a very horrible snake coming in my dream. See, the dream analysis is connected to the Vata Prakopa. Kama Shoka Bhayat Vayu Prakopa Mapatyate. And patient is having another important issue. You see the right column. What are his complaints? He says, I am having only Crohn's disease. Crohn's disease is identified by pain abdomen, vomiting and weakness. Only 3 major issues of Crohn's disease. But he says he is having eczematous dermatitis. See the right column keeps on going. Eczematous dermatitis, gastritis, pharyngitis, urethritis, colitis, proctitis, rhinitis, bronchitis, uveitis, ascites, vasculitis. And when I went down seeing his mobile phone, all these documents are there in the mobile. Now can you see this is Crohn's disease? Crohn's disease is not like this. And we took one blood sample. He was known case of appendicitis, so he was done with appendicectomy. He was having lip hypertrophy. His one of the lip was hugely swollen. All these things are going in favor of Kapha Pittaja or Sannipataja Grahani Lakshanas. Kapha Pitta Pradhana Sannipataja Grahani Lakshanas. And on 15/11/2024 patient came, and usually I charge 200 rupees for my consultation. I took 500 rupees because he has taken 1.5 hours consultation. So 5 of my patients have gone back. So on 15th I have given 10 days medicine. That one is Pitta Shekara Rasa, Rasagalli Medabu, one of the Siddha medicine, and Hemagarbha Potali Rasa. Hemagarbha Potali was given because Atyayakam Vayu. Whenever Vata is becoming impaired, all Grahani Lakshana will become very much highlighted. He is having one of the blood tests I did for him. He said, no blood tests are, all my tests are normal. I took 2 blood tests. One is serum lithium, it was very low. Another is serum IgE, immunoglobulin E. Immunoglobulin E was 1600 and above. In a patient of IBS, no modern medicine doctor will think about IgE. In a case of Crohn's disease, no modern medicine will think about serum lithium levels. Serum lithium levels were below normal. Below normal lithium level is going to cause choking of thyroid gland, choking of the intestinal mechanisms, that is called gut neurobiota. This neurological system is connected with the microbiota of the guts. If this is hampered, they will have multiple itis, gastritis, ileitis. He was also checked for tuberculosis. Tuberculosis was normal. Weight loss is there, no tuberculosis. Itis is there, no jora. He is having this complex presentation. He got 40% improvement in 7 days treatment, and in the next follow, he said, I am better by 40%. So this is one of the Crohn's disease diagnosed by modern doctor, IBS by modern doctor. Ayurveda Chikitsa is only Grahani Dosha Chikitsitam, Kapha Pitta Pradhana Tridosha Sannipataja Grahani Chikitsa, and patient showed better improvement. Next case is how Vataja Grahani Dosha will represent. What the next previous one? Next. This is one of the best case to know Vataja Grahani. I was studying about Vata, Sa Vata Gurma Hudyoga Priyasham Teacher Manava. In my government hospital OPD, I will write this shloka as my diagnosis. Many of my students will be doing this. He was a Lingayat Swamiji, very gentleman, no alcoholic, no tobacco chewing and all. He said, sir, I am having bad gastric problem, very big gastric problem since 10 years. I have seen all gastroenterologists. I am not feeling better. And one of the gastroenterologists called Dharma Reddy, he has shown that you are having tinea corporea, one of the skin manifestation. He is having upper GI endoscopy showing gastroduodenitis. Patient is having Agnimanya, Vishtadajirna Lakshana, and he is operated for lichen planus and eye problem, and he is having Padadavaha, he is having Griva and Katishula. See, where Grahani Dosha is there and Griva Shula, Katishula is coming. IBS patient and neck pain, doctor will tell, I am seeing IBS, you go to neurologist. Doctor will not see that. But Ayurveda say, Sa Vata. Vata is cervical spondylosis and lumbar spondylosis together in a patient. I call it as CSLS syndrome. One of my diagnoses called Yatra cervical spondylosis, Tatra lumbar spondylosis. You can watch this case. This Vyapti is there in Grahani Rogi. Another patient will come. I have given it as JK syndrome. Yatra Kati Shula, Tatra Janu Shula. These are coming with IBS cases. Then what we should understand, IBS is not related with any of this spondylosis or spondylitis. Then what I understand is Savata. This is due to Vata Lakshana. Savata. Gulma. Patient is having the fatty liver. He is having fatty liver. He is having prostatitis. He is having vasculitis. He is having osteitis. That is CSOM. He is having the CSOM. He is having hypertension. Patient is having anidra. He is having udgara. And patient is having vibandha. Whenever vibandha is there, we call it as IBSC. So, Vata, patient is having spondylitis. Gulma, patient is having fatty liver and hepatomegaly. Patient is having prostatomegaly, fatty liver. He is also having right ventricular hypertrophy. See, one of the beauty of Grahani patient, he is having right ventricular hypertrophy. And patient is having right bundle branch block. And he is having B12 deficiency. His IgE is 1266. He is having left inguinal hernia. And he is having splenic cyst. All these are written in the left column. And for your kind information, gastroenterologist has not done any blood test. B12 diagnosis, IgE diagnosis is by poor Ayurvedic doctor. And I have done ultrasound scanning. They do endoscopy, normal. But when I did ultrasound scanning, prostatomegaly and fatty liver are saw vata gulma, hridroga. He has not done any ECG. Patient says chest pain, he says it is psychosomatic. But I have taken ECG, it is right ventricular hypertrophy with right bundle branch block. What else you want to tell that the Shastra is Pramana? Ayurveda is better than modern gastroenterology. Because I can treat right bundle branch block, hyper IgE syndrome, fatty liver, and even including B12 deficiency and prostatomegaly with hernia alone. What I have done, only I have done 2 drugs. One is Avipattikara Churna with Chankabasmam. Another is Amla Pitta Mishana, a symptomatic drug. And with this patient was ready to go to Bengaluru for any big corporate hospital. See, a poor Swamiji want to go to Apollo hospital because allopathy doctor said you go to Bengaluru hospital. But with this Avipattikara Churnam and Amla Pitta Mishranam, and patients start improving in all parameters, all biochemical parameters and ultrasonographic parameters. So the sounds of the Professor C.P. Shukla is ringing in my ears. He used to tell this, Sa Vata Gulno Rudroga Pliha Shinkicha Manava. This same shloka you can write on the OP slip, and same Ayurvedic drug can be given as one of the Samprati Lakshana Yoho Sambandha. This is one of the beautiful concepts in Ayurveda, where you should understand Samprati and also Lakshana, again give some suitable drug. And Avipattikara Churna is for what? It is Pachanam, Anulomana, it is Sroto Shodhanam, and it is Vatanulomanam, Vibandha Haram, Tiktam. And Avipattikara Churnam is one of such great yoga. In general practice you can practice. And instead of, and now those Tampanamaranti is one of the Chikitsa Sutra for Atisara. But here it is IBS with C. So Avipattikara Churna is not a bad idea. And with that, one of the symptomatic drug was given is only Amla Pitta Mishana. See, with this case sheet, patient will go to Ayurveda doctor, patient will go to allopathy doctor. Allopathy doctor will be giving respect to you because I have diagnosed better than modern doctor. With biochemical parameter and ultrasound parameter, we have diagnosed one shloka on the thing. If allopathy doctor writes IBS, Ayurveda doctor will understand. If I write Savata Gulma Rudroga Pliha Shinkicha Manava, gastroenterologist will not understand anything. So that is the basis of Ayurvedic integration. The integration should be like this. Understanding of Vataja, Pittaja, Kapaja, Grahani is understanding the dosha inside the Grahani. Vata Pradhana, Pitta Pradhana, Vata Pitta Pradhana, Salipata Pradhana. Then we are able to understand some of the patients like this. Next please. One of the patients, he came with, in this patient, BPH, cystitis, left ventricular diastolic dysfunction, and he is having IHD Shota. See, patient came with Udavarata Lakshana, cerebral atrophy, chronic case of, it is diagnosed as Shiras Toda. Patient came with severe headache, no relief by antipsychotic drug. But what I have diagnosed is, we have diagnosed it as Savata Gulma Rudroga Pliha Shankicha Manava. In one of the case, what we have treated is same on that line. Patient was given Vatanulomanam and the patient was given Agni Deepanam, Agni Samyakaranam. Not only Agni Deepanam, firstly give Agni Samyakarana Chikitsa. You see that patient should be treated for a certain period of time so that patient's Vata Pitta Kapha becomes equilibrium, patient's Agni becomes equilibrium. Agni Samyakarana is one of the patientful Chikitsa for a Vaidya. Don't be in a hurry. Don't think about the quick drugs. Don't put any strong rasaushadis. Don't put any costly drugs. No Swarnakalpas. Only if you think about diagnosis and you can treat better this case. Next, this case is very interesting. Post COVID-19 case. In this case, you can see one of the important thing is interstitial lung disease, Kampavata, COPD. Patient is having mitral regurgitation, LVDT, left ventricular diastolic dysfunction, old pulmonary tuberculosis, and patient is having CRP rest. Patient was treated with one of the model physician for tuberculosis, but IBS was his doubt. But on diagnosis, I came to know that interstitial lung disease is one of the Hridroga Lakshana. This is carpulmonale, where Hridaya and Shwasakosha both are involved. So, Savata Gulma Rudroga Pliha Shankicha Manava. was taken as bronchiectasis was there in the CT scan, and bronchitis with atelectasis, lung fibrosis was there. ST Madhu Rasayana was given in this case. I still remember Vardhamana ST Madhu Prayogam. ST Madhu Ghrita was given in the end. I will touch some of the medicines because if you go through Nidana Panchakas and Lakshanas and investigation, time will be consuming. Wherever needed, we will give some of the medicine. This ST Madhu Ghrita was given for Brahmanam. ST Madhu Churna with milk was given as Medha Rasayana. ST Madhu is Medha Rasayana. ST Madhu with Kshira is Medha Rasayana. Medha Rasayana and Brahmanam ST Madhu Ghritam has helped in this interstitial lung disease with Savata Gulma Rudroga Pliha Shankicha Manam. One of the pioneer clinical practice, you can think about this. I think one more thing I will tell and conclude this Vatapitta Kafaja Grahani, because I will connect all topics to Vajikarna. Kafaja Grahani is having Strishu Aharshanam. Kafaja Grahani, Charaka says this in Shloka number 170. Kafatmike Dushto Madhuraha Udgaraha Sadanam Strishu Aharshanam Akushasyavi Daurbalyam Kafatmike. In this case, I have seen many patients. I diagnose it as erectile dysfunction, male sexual dysfunction. Gradually we check Nadi, we also check Grahani. And I ask the patient, how is your digestion? Patient says, I am having lot of heaviness in the abdomen. Kapha Dushti Lakshana, Kafaja Grahani Lakshanas. He is having alasyam, lassitude. What is that? Sadanam word is used. Sadanam is Anga Sadanam. Many times we call it as Anga Mardam. Sadanam is Mano Sadanam, Mano Avasadam. Mano Avasada is Vataja Grahani Lakshana. And in Kafaja Grahani Sadanam word is told that Sadanam is Strishu Aharshanam Sadanam. Post-coital body pain, post-coital lumbar pain, post-coital suprapubic pain, all these are Sadanam. So when we see these cases, Shukra Kshaya Lakshanam, Kafaja Grahani, Kafaja Shukra Dushti, Strishu Aharshanam, erectile dysfunction, instead of giving Magaradhajam, instead of giving Ashwagandha, I start giving one of the commonest prescription for this Kafaja Grahani. What I use is normally a Shunti Sadhita Jala or Shadanga Paniya. You use any Shadanga Paniya or use Shadanga Paniya for preparing Manda, Peya, Vilepi. Where Manda is having more water and less rice, such Manda, Peya, Vilepi, you start giving as Ahara Dravya should be given first for Kafaja Grahani, then Deepana Pachana drug, then any Shadanga Paniya or Pipali Sadhita Jala or Chudu Vellam, simple Chudu Vellam you can give, then Sadhita Ushnodakam followed by the Shodanam. You can give Avipantikara Churnam or Amalaki. Amalaki is one of the Virechana drug. Amalaki is Pancharasam. Amalaki is Pachanam, Vrisham. Amalaki is Pachanam, Vrisham, Grahani Dosha Samsanam. It will cause Sroto Shodana. Then after those Sroto Shodana, you can see that Amalaki is having Vrisha effect, but alone Amalaki is not to be taken. And I was talking to Dr. Dharmadhikari sir. We should take in the name of Amalaki Chavana Prasha. Chavana Prasha is Reto Dosha Haram, Pum Dosha Haram, and even Artava Dosha. These sort of Vrisha yogas, if you give it for Kafaja Grahani Lakshana and even Shadanga Paniya or Musta Karpata Koshira, Chandanojitya, Nagare, any one of the drug in these drugs are Shadushanam, Panchakolam, Trikatu Churnam. If you give only Trikatu Churnam with Buddha as Anupanam, Kafaja Grahani, Angamardam, Sadanam, depression, serum lithium levels, and even interstitial lung disease, middle-aged men having Strishu Aharshanam can be treated very well. Thank you, sir.
Thank you so much, Dr. Madhav Diggavi sir, for in detail explanation with the case presentations regarding the symptomatology of the Grahani as such is concerned. How different phases the patient comes and which can be diagnosed as Grahani and treated based on Grahani, so that the other symptoms by themselves they will subside. So in 57th shloka, Charaka says that Apatvam Dharetyanam Patvam Srijati Pashudara Durbalagni Pala Dushta Amave Manchati. So when the patient, when the Grahani is not holding the Dharana and Vimunchana Karma, there is disbalance, then the Grahani Dosha will occur. As in detail we heard from Dr. Prashanth regarding the Hetu and the positive factors in detail. So now I request sir to in detail can we have a look upon the treatment aspects such as Deepana, Pachana, Stambhana, Sangrahana, like all the treatment protocols, where to use which one, where to do Deepana, where to do Pachana, where to do Stambhana, where to do Grahi. So these we face very much confusion in clinical practice. So in detail I request sir to please throw some light on this concept.
Pachenam Vandikritya, Deepanam Pachatyamam Navarnikritya, Pachanam. Any Deepana Dravya, basically they should be of Vayu Akasha Tattva predominance. The basic Panchabuddhika nature of the Deepana Dravya. But Deepana Dravya or Deepana Chikitsa may be Dravya Bhuta, it may be even Adravya Bhuta also. When it is Adravya Bhuta in the form of Upavasa, or in the form of Lagvashana Darshana, so looking into the severity of the Amatva, we should be addressed. Pachenam Vandikritya Deepanam, Vayu Akasha Tattva Pradhana Dravya Ajamoda, Ajamoda Churna, Sasaindava. So these are the Deepaniya Dravyas. Basically, they are addressed in Amajirana, in Amavisha, and conditions like Amalakarani and so on, including Amasara. But when the patient of Amalakarani or Amasara comes, we have to remember Vakpata's statement of Samudaya Prabhava of the yoga. There is one famous yoga being very popularly practiced by many Vaidyas, that is Kalashaka or the Kashayam. Kalashaka, Patya, Mahaushadhi. Kalashaka, Patya and Mahaushadhi. Only three components in equal proportion. Kalashaka is the Bergeraea koyanji, what is called Kadurumba or Curry Bevina ele, curry leaf. Patya, Haritaki, and third one is Kalashaka Patya, Mahaushadhi, Shunti. Kalashaka is Sangrahaka, Deepana. Patya is Vatanamana, and the third one is Shunti is Pachana, Deepana. Therefore, Kalashaka, which is Arochakara, Sangrahaka, Deepana Pachana, Shunti, which is Deepana Pachana, Vaishwanara, and any aggressive roga, which is given. The third one, Haritaki, Kritwapaka Malana, Tat Vitvabanda Madonaye, so, when a patient of Amalakarani comes, or an Amatsara rogi comes, first of all we have to eliminate the doshas. We have to allow the patient to get the doshas eliminated. Natu Sangaranam Deyam Puramevum Amatsarane Vipattamana Pradosha Janenti Amayam Bhavunta. Suppose patient of Asara comes without making the judgment whether there is Amadosha Pravartana or a case of Grahani comes without making the proper assessment of Malaparisha and other different symptoms, Machatyama, Gurutvacha, Vitipakvata, Pulavejane. So it has become a very difficult job whether your Purisha is getting floated over the water, whether there is Majjana due to the Gurutva, nobody can say because of the closets of the today's practice. Today is the Western trend or the Indian side of laboratories. However, by other symptoms like Arochaka, Gurutva, Madhurasyata, and Lanasrava, Pralasa, Praseka, the various other components where Kapha-dosha dominant features are noticed, we have to make the decision that patient is having Kapha and Amatva. Therefore, Kalashaka Patya Mahaushadaihi, this yoga is if given, patient will get in Malapravartana for a day or two. Then by next day patient comes. Doctor, you have given such a Kashaya, such a Ganavati. Instead of getting the Malapravartana which is stopped, I am getting again and Vega, again. Have you given a drug to mistakenly by mistake? Have you prescribed mistake drug? No. And I also heard that after I receive some Ayurveda treatment, there is increment of the disease condition worsens, then that comes to normalcy. So you have to answer for everything. So therefore, Deepanam Pachanam Chaiva Ushnatvat Dravashochakrit. Basically, Dravya should be Deepana, it should be Pachana. Ushnatvat Dravashochakrit. Now, what is the difference between Stambha and Grahani? Stambhana Dravya. Stambhana Dravya is basically love. That is Lavupakachaya Dravya. They are in Lavupakavastha. Means, when somebody consumed within no minutes, it can digest it. But further what happens? Yatha Vasaka Tuntuko Dravya Kutaja or Shonaka, they become Stambhaniya. Rukshatva, Shitatva. They are basically Shita and Ruksha. Shita and Ruksha, cold and dry. Lavupaki Vatakrit Sambhanami. And the Stambhana, karma is Vatakaraka. So spasms, contractions are developed. Without acting on the agri much. Stambhaniya Dravyas are acting, by directly acting on the agri, Deepana Pachana and Sangrata Dravyas are acting. Therefore, Deepanam Pachanam Chaiva Yadushtatva Dravashochakrit. If you wash your clothes, expose it to sunlight throughout the day, how it is getting dried, how the sunlight getting absorbed, it is absorbing the water component, and by the evening, how the cloth becomes dried and shushka. Similarly, Stambhaniya Dravya, what happens? You have to compare to the fan. So you are washing your clothes and putting your clothes over the for drying, putting the fan and go out by locking your door, going to the college and coming back. By the evening when you come back, again you see that your clothes is dry. So while Akash is dominant, your fan is rotating in while speed, will be carrying all the tattva and dryness is also created. So Shushkata and Drukshata. So Dravashoshakrit. So Dravashoshana can be out of agri and Sanyoga, it can be without that by the Vaya Akash Tattva. However, Vaya Akash Tattva, predominant Dravyas are Shita in nature and Sangaraka Dravya, they are Deepana and Pachana, Uttanatva. I can quote an example where Shardana Yoga has been mentioned by Acharya in the Amashaya Vata. Amashaya Vate Hitam Yoga Shardana Mevacha. Mustakayana Yoga Pata Katukavati Visha Abhaya. Musta Sangravaga Deepana Jwaragna Pachananam Srestana. So any patient of diarrhea, any patient of malabsorption syndrome, what is called as Crohn's disease appears, Mustakarishta or Mustasita Takra, Mustadi Ganavati. Why? Musta Sangraka Deepana Pachana Jwaragna. So Mustaka Indraya Pata. Indraya is the Kutaja, Kutaja Bija. Pata is Tikta Kashaya. Katukati Visha Abhaya. So Katukarohini, Ativisha and Abhaya. So there is combination of Deepana, Pachana, Vatana Logan Traven Shadharana. Yoga Shadharana Yoga Devacha. So the Ama Tattva which is released, it is going to the Dharana of the Sharira without causing the Ama Vishotpatti. Ama Visha in the form of Visuchika, Alasaka, Dandalasaka and other varied forms. Patient may get severe amount of cholera, he may develop gastroenteritis. In such a case, to prevent and treat and address, so Shadharana Yoga. In Shardana Yoga there is a second version. Instead of Pustaka, it is Chitraka. Chitraka in the Yoga Pata, Katukati Vishavaya. So remove Pustaka and add Chitraka. So Madhav Diggavi was telling regarding the Shadangapaniya. In Shadangapaniya also there is one more Mahatva. Vinashunti Shadangodaka and Sashunti Shadangodaka. So Sashunti Shadangodaka is working in Pittadika Jara and Pittadika condition. In that case, Shadangam Chukukudade, Shahapratam, Pibetranam. So remove the Shunti and substitute with the Guduchi, Tiktaka and it is Deepana Pachana. So in that way, the removal, subtraction and addition and vikalpas are prepared. So Deepana Pachana, Sangrahaka. We had a great study in our institution, the Department of Kajikistan. We have prepared Purisha Sangrahaniya Kashaya Sarika Niruvamasti in patients of irritable bowel syndrome. So one patient I remember, a case from the BVB Engineering College, one of the very popular engineering colleges across Karnataka and India, Technological University. That time there were no any semester system. Now all the courses are coming with the semester system. Even our MD Ayurveda is a semester for the research methodology and statistics. Very good. So the student had examination. When every examination comes, when the examination comes nearby, severe stress and diarrhea. Doctor, my problem is emaciation. My problem is stomatitis, mukapaka, jihvamaka, and whenever I take a cup of tea, I have to search for toilets. Whenever I have some breakfast, I have to search the toilets. But you know, the situation of the toilets are not good. I am hesitant of going there. I am hesitant of attending. So there was this problem. Now, the second question. Do you feel examination just like as if it is like Himalayan mountain? Yes sir, really, and the examination is coming nearby, I feel I have to climb